Hello. Hi community. Naomi Anderson here from Aged Care Ready and founder of our Aging Parent Support Group on Facebook. I'm doing a live on my own tonight, so please be kind. I might babble on a little bit, sorry about that. Tonight we will be talking about where to start on the aged care journey, because this is something that I get asked a lot working with Aged Care Ready. But before we get stuck into it, now would be a really great time to let me know that you're here so that I can see you. If you have any questions, do pop them below and I'll answer them as I go. I can see Erin's in. And I can't see you guys unless you actually tell me that you're here. Awesome. Now would also be a great time to tag anybody that you feel would benefit from seeing this as well. All right, so let's get started. And I guess we should probably start from the beginning. And in a perfect world, this is how it would happen, but we live in a very imperfect world, unfortunately. And I guess the starting point for each family will be different. So my biggest recommendation, I guess, is to start the conversation as early as possible. And that's, you know, not always easy to do, especially with the older generations. But, you know, making sure that they feel like that they're in control and that they have some say is, it's ideal, essentially. Making sure that you explain to them that in, you know, should the time come that they need care or they need some extra assistance, that you know exactly what what their wishes are. The conversations could be basic. When you start to notice that, you know, mum or dad is struggling a little bit around the home, you could say things like, "Mum, you know, I noticed that you're starting to struggle a little bit. Would you like me to organise someone to come help clean the house," for example. So it could be taking those baby steps. Ideally, what you would like to do is have those conversations well before that point. And so they could be quite complex conversations, everything from, you know, asking them about what type of care they would like in the future, if, you know, staying at home for as long as possible is what their ideal situation would look like, or whether they would like to be placed in a home and what that home would look like. For example, you know, mum might say, "I'd like to be placed into an aged care facility that's small with like-minded people and a very active lifestyle calendar," or something that's a bit quieter. So starting those conversations earlier gives them a lot more say and a lot more choice in what actually happens to them. My other suggestion would be to be prepared. So when having these conversations, and again sooner rather than later, is having those powers of attorneys, the wills, statements of choices, and the financial plans already in place, because these things are really, really difficult to coordinate once mum or dad just don't have the capacity, or they're starting to lose the capacity. So that will give you clear direction on what their choices are. And like I said, that's in a perfect world that would happen, but we do live in an imperfect world. So by the time a client and their family comes to us, there are two main pathways that we see forming. So one is generally where a family member comes to us and they're concerned about mum or dad because they're deteriorating or they're no longer coping at home and the family is concerned. And the second pathway is when a catalyst has occurred. So either mum or dad have fallen, broken a hip, they're in hospital and they can no longer leave hospital or transitional care or rehab. They need to go into a facility immediately. And that's probably more often than not from what we see. Either way, the first thing that needs to happen is that they need to be medically assessed. So if it's confusion, for example, the GP or the medical officer will have to do some further testing, whether that's pathology or scans, just to rule out any underlying issues that might be there, like, for example, delirium or electrolyte imbalances and things like that. Just do a full workup. And from there, an ACAT assessment is done. So an aged care assessment team member is contacted. So you can do those referrals by the GP, the hospital, or in the community as well via the My Aged Care website. And all the steps I'm talking about here tonight, I'll pop all the links in the comments below for you so that you have access to them. So you can actually do a referral for an ACAT yourself if you're concerned about a loved one. And then I guess from there, when a referral goes through, it really depends on how urgent it is as to how long it takes to be assessed. In the hospital system, it's a lot quicker because generally people need to be moved along. In the home system, it can take a few weeks. And I guess from a COVID-19 point of view, they could take a little bit longer. I know some of our community members have been quite shocked at how quick they have been though recently, so that's really good, and they're putting all their measures into place as well for infection control. So once mum or dad is assessed, that report will tell you whether they're assessed for home care, respite care, or for permanent placement. And there are a number of different things here at play. So they may be assessed for a Commonwealth Home Supported Program place, or they could be assessed for a home care package. So both of these things are for care in the home, but they're very different. So people get these confused. The Commonwealth Home Support Program is a subsidised program where that's essentially where the council comes out and helps you with more basic needs, transport to appointments, for example. So the client is still paying for these services, but at a subsidised rate. The other thing is the home care packages. So that's levels 1 through to 4. And that's where you choose a provider or an external agency, for example, that will provide care for mum or dad. And the provider will receive money on a daily basis to provide care for them. And that's usually for things a little bit more complex. Things like you know, cleaning, gardening, allied health, meal prep, home modifications, and that sort of thing. And the wait time on that varies. So a level 1 package, for example, at the moment is a 3 to 6 month wait, and the level 1 package is usually funded at around $8,750 a year, whereas a level 4 package, which it would indicate that you have high care needs, would be approximately $51,500 a year that you could put towards care, and the wait times for that are huge. Now, there's a difference between being approved for a home care package and allocated a home care package, and that's that wait time. So once you're approved, then you go onto the wait list. And then essentially what happens is that you need to wait for somebody else to give up their package before you can get yours. And then when you're allocated a home care package, you have a certain number of weeks to decide on who your home care provider will be. And I'll pop the links below for all of that information for you as well. In your aged care assessment or your ACAT assessment, you will also be told whether or not you've been approved for respite. Now, this could be community respite or residential respite. With the community respite, it could be things like outings, it could be day centres, which are absolutely fantastic, and they do half-day or full-day services, just to give the family a little bit of a respite, essentially, a bit of a break so they can go and do what they need to do. Residential respite is a little bit different in that every year the person who is going into respite has 63 days per year where their accommodation is paid for by the government. But there are additional fees to this. So like we had previously spoken about with Anthony Sultana from Creo Wealth, there will be a basic daily fee and extra services fees that the client will be expected to pay during their stay. It's just their accommodation costs that are covered under the respite approval. And then from there you can choose to go on to permanent placement as well, and this will be assessed as being high or low care. So essentially, to recap, it depends on what your individual situation is, but you need to rule out any medical issues. So go to your GP first if you're still at home. Then you need to have an ACAT completed, so an assessment done to approve you for care. Otherwise, you won't be able to get in. There are ways around it. It's just a little more difficult. And aged care facilities don't like that so much because it's harder to chase their funding for having somebody in a facility without an ACAT assessment. Otherwise, you have to pay the full fee, which is hundreds of dollars a day. And then from there, you need to decide what type of care your loved one needs. So whether that's in-home help care, so that could be through the Commonwealth Home Support Program, which is the council, or a home care package, which you could be waiting for, or respite or permanent care. Just with the home care packages, if you have been approved for a home care package or your loved one has been approved for a home care package, but you haven't been allocated one yet, there are options to self-fund some care in the interim if you're in a position to do that, which means that you can already choose your home care provider and go to them directly and pay them directly for care if you can't wait for the package to come through. Sometimes what will happen is you may be approved for a level 3 package, for example, but be allocated a level 1 package pretty much straight away, and then you're waiting on the higher allocation. So it gives you a little bit at least in the interim, just to make sure that your needs are being covered. But what we find is that by the time, you know, a lot of the level 2, 3 or 4 packages are actually allocated, that person already needs to go into care. The wait is just too long. What we have created at Aged Care Ready also is a step-by-step guide PDF. So if you're wanting to have a copy of that, just PM me your email address and I'll send that through in the next couple of days for you. It's really handy. So it guides you through exactly which steps you need to take. And that's pretty much it with getting started. Did anyone have any questions, keeping in mind that there's a bit of a lag here? No, that seems to be it. If you do have any questions and you're not quite sure where to start or what steps you need to take, feel free to reach out. That's exactly what we do at Aged Care Ready. We're there to essentially guide you and help you navigate the aged care space, whether that's just through advocacy like what we do through the group, so giving you some guidance, showing you what all the options are, or actually standing in and acting on the family's behalf and the client's behalf. So it's free to have a chat. Just reach out if you need any help. And like I said, if you would like a copy of that PDF, just message me your email address and I will send that through in the next couple of days. Thanks, guys. Good night.